So we were speaking about wound care and how it affects the economy, how it affects the residents and the seniors who get these wounds. And we wanted to continue the discussion to see about the financial aspect to it.
Sure. To us as a team and a philosophy, to me the impact to the individual is always the key, their quality of life. But financially, it can be a huge drain. A single wound, and when we talked about pressure injuries, just to remind everyone, it's damage to the skin. That could be anywhere from superficial down to muscle or bone. Estimates go anywhere from the low end of $20,000 per incident in the high 100, 120, 150 or more, depending on what needs to be done. Now that involves hospitalization, potential surgery, IV antibiotics, home care nurses to go out and do skilled nursing care for the wound. Wounds can take anywhere from weeks to years to heal.
Oh my goodness.
For individuals with multiple wounds, the financial burden can be really extremely large. Again, to me, we always at ICS think about the financial piece, but the quality of life piece we see every day. We see the impact for those who can't take care of their children. I think of one young mother who had a physical disability who couldn't care for her school-age children. Those seniors who most important to them is to attend a religious service, and they can't attend the service because they have to be in bed because they have a sore somewhere on their body.
Oh.
So. The financial piece is tremendous, but I think the quality of life piece is what we really try to focus on for our folks.
But while we're on this financial side to it, if they're on the MLTC, they're not paying for it, are they, if they're a member of the organization?
Paying for the services?
Right.
No, we're taking care
is...
Well, the cost to Medicaid and to Medicare and to the federal and state governments, hospitals, yeah, it's all entailed because everything involved in that care needs to be paid for, not by the individual because they're on the plan, but eventually by the state and federal government because they need a special chair, they need a special cushion, they need IV antibiotics, they need hospitalization, they need a surgeon. So all of those cases add up, and that's again why we really focus on the preventative piece, because prevention is so much easier and so much more cost effective than treatment. And I think often there are those who think very within the box in terms of what we can do to treat these or prevent these. At Independence Care System, we really think way outside of the box. So I had previous experience. I had worked at a CHA, Certified Home Health Agency, where we really were very much by the rules of the Medicare and the Medicaid, and that sometimes tied my hands in terms of what I could get for an individual in terms of equipment or services. At ICS, if there's a need for it, we get it for the individual, which I think is unique, and it's probably why I've been there 16 years now, because really we have been able to impact the quality of life of hundreds and hundreds of different individuals.
So I have a question for caregivers who are still have their loved one at home with them and who are not on an MLTC plan. What can you suggest to them for prevention or to be on the lookout for?
The biggest thing is education. Be educated. The internet is a wonderful place in some ways, but go to places that there's something called the National Pressure Ulcer Advisory Panel. There's lots of lots of wound care sites that talk about prevention. But there's wonderful literature out there that talks about what can you do, because education is the key. My husband's a military guy, and he says forewarned is forearmed. So if you know what you're doing going into it,
yes,
then you're going to be prepared. And it doesn't need to be complicated. It's knowing, if I'm caring for you as an elderly parent, what do I look for? How do I keep you moving? How do I take a look at your skin a couple times a day? How do I get you engaged so that you're moving to prevent this? If you know what causes it, because in order to prevent them, you first need to know what causes these? How do I get these? Most people think immobility. I can't move because I'm weak, because I'm aging, because I have a new hip. But the bigger piece is for those who can move, but because of severe depression, do not move, which happens with isolation with the elderly sometimes because of dementia. They're very capable of getting up and moving, but we need someone to say, hey, you've been sitting, let's take a little walk. Let's walk from here to the kitchen and come back. Let's take a stroll outside. So it's really knowing what can cause the wound and then knowing what to do. And they're not really complicated interventions. They're very simple, but you need to have that knowledge in order to be able to prevent.
That would be great if you could put that on your website. Do you have something about wound prevention on your website?
We actually, we have great tools that we use. They're called stoplight cards that we give to the families and the caregivers that, have a red, yellow, green. The green is great, everything's going good. Yellow, let's think about what we need to do. Things are, and then red, where we really need to aggressively address it. So we have those for all different types of conditions that our members might face.
Thank
We
you.
also have a wound care tip sheet as well.
Yes.
And so if people go to our website, doesn't have to be a member, website's www.icsny.org. They go to our specialized programs. They can see all of our specialized programs and download tip sheets, including a tip sheet for our wound care and prevention as well.
Thank you. And viewers, I think you'll find that helpful that we're going to put the website address as we're speaking about this, because a lot of viewers who are not members of your organization yet could benefit from having a tip sheet.